Hello and welcome to the Revenue Cycle Decoded channel. I'm your host, Gina Cornett, and we are breaking down all things revenue cycle. Today, we're going to talk about some very important responsibilities of patient access personnel. If you're new to patient access, you have joined an incredibly important part of the revenue cycle team. You're often the first person that patients interact with when they come to receive care, and that makes you the frontline expert in helping them understand their insurance and their financial responsibilities. So today we're going to talk about insurance terminology, words and phrases you'll hear every day in your role. We'll cover key terms like copays, coinsurance, deductibles, in-network versus out-of-network, balance billing, the No Surprises Act, contractual allowances, and maximum out-of-pockets. By the end of this episode, you'll not only understand these terms, but you'll also be able to explain them clearly to patients so they feel informed and confident about their financial responsibilities. So let's get started. A copay is a flat fee that a patient pays for a specific healthcare service, like a doctor's visit, prescription medication, or an emergency room visit. The amount is usually, but not always, listed on the patient's insurance card and is usually paid at the time of service, although it could, depending on your organization's policies, be billed after the service is completed. So, for example, if a patient's insurance card says their copay for a specialist visit is $40, they're responsible for paying that $40 when they check in for their appointment. Copays don't usually count towards deductibles, but they may count toward the patient's maximum out-of-pocket limit, which we'll discuss later. When explaining copays to patients, just keep it simple. Your copay is the flat fee that you owe today for this service. Now, a deductible is the amount that a patient has to pay for healthcare services before their insurance starts covering costs. Once the deductible is met, the insurance typically starts sharing costs through coinsurance or covering services entirely. So here's another example. If a patient has a $1,000 deductible, they'll need to pay the first $1,000 of their medical expenses out of pocket. After that, their insurance will kick in according to their plan. So here's how you can explain this to a patient. Your deductible is like a starting line. It's the amount you need to pay out of pocket before your insurance starts sharing the cost of your care. That brings us to coinsurance. Coinsurance is the percentage of healthcare costs that a patient is responsible for after meeting their deductible, and then the rest is covered by the insurance plan. So, for example, if a patient's coinsurance is 20%, they'll pay 20% of the cost of a service, and their insurance will cover the other 80%. So, for a $100 service, the patient would pay $20 and their insurance would cover $80. When talking to patients about coinsurance, use percentages. After you meet your deductible, you'll pay 20% of the cost of services and your insurance will cover the rest. Now let's talk about in-network and out-of-network providers for a minute. In-network providers, or they could be called participating or par providers, are healthcare providers who have an agreement with the patient's insurance company to offer services at negotiated rates. Out-of-network providers, on the other hand, or non-participating or non-par providers, don't have these agreements, which often makes care more expensive for patients. Here's an easy way to explain this. Think of in-network providers as being part of your insurance company's team. When you stay in network, your insurance plan covers more of the cost. If you go out of network, you might pay significantly more because those providers don't have a cost agreement with your insurance. Encourage patients to check if their providers are in network to avoid unexpected costs. Balance billing happens when an out of network provider bills a patient for the difference between their charges and what the insurance company pays. For example, if a provider charges 200, but the insurance only pays 120, the provider might bill the patient for the remaining $80. But here's where the No Surprises Act comes in. This law protects patients from surprise medical bills in certain situations, like emergency services, or when they receive care at an in network facility but are unknowingly treated by an out of network provider. Here's what you can tell patients. The No Surprises Act helps protect you from unexpected out of network charges in emergencies or when you didn't choose to see an out of network provider. If you have questions about a bill, let us know so we can help. Now let's talk about a contractual allowance. When a provider is in network, the insurance company has already negotiated a lower rate for the services provided. The contractual allowance is the difference between the provider's full charge for the service and the amount the insurance company has agreed to pay. For example, if a provider charges $1,000 for a procedure, but the negotiated in network rate is $600, the $400 difference is the contractual allowance. This amount is not billed to the patient. It's written off by the provider as part of the agreement with the insurance company. Here's how you can explain this to a patient. Your provider gives your insurance company a discount on the cost of your care because they're in network. That part that's discounted, called the contractual allowance, isn't your responsibility to pay. Understanding this concept can help patients feel more confident that they're not being overcharged for in network services. And finally, let's talk about maximum out of pocket limits. The maximum out of pocket is the most a patient will have to pay in a year for covered healthcare services. This includes deductibles, copays, and coinsurance. Once the patient reaches this limit, their insurance covers 100% of additional covered services for the rest of the year. So if your patient's maximum out of pocket limit is $5,000 and they've already paid $5,000 in deductibles, copays, and coinsurance, their insurance will cover all additional covered costs for the rest of the year. You can explain it this way. Think of your maximum out of pocket as your safety net. Once you hit that limit, your insurance takes care of the rest. Now that we've covered the terminology, let's put it all together with an example. Imagine a patient comes in for an in-network procedure that costs $1,200. Here's how their financial responsibility breaks down. The provider's full charge is $1,200, but the contractual allowance reduces the charge to $900. That $300 difference is written off by the provider. The patient has a $500 deductible and hasn't paid any of it yet. They're responsible for the first $500. After the deductible, their coinsurance is 20%. They owe 20% of the remaining $400, which is $80. Their total cost for the procedure is $580, and their insurance covers the rest. So when you're explaining these breakdowns to patients, keep it simple and use real numbers whenever possible. Patients will appreciate the clarity and they'll feel more confident about their financial responsibilities, and examples such as this can help them plan for the cost of their care. Understanding insurance terminology is key to your success as a patient access professional, and more importantly, it's key to helping patients feel informed and supported. Whether you're talking about copays, deductibles, or contractual allowances, your ability to explain these concepts in a clear, patient-friendly way can make all the difference. If you're ready to dive deeper into the world of revenue cycle and really sharpen your skills, check out my Revenue Cycle Bootcamp. It is a comprehensive course that covers everything from patient access basics to advanced denial management and collection strategies. So whether you're just starting out or you're looking to grow your career, my Revenue Cycle Bootcamp is packed with practical insights, tools, and resources to help you succeed. Click the link below to learn more and enroll today. I can't wait to see you there. If you found this episode helpful, don't forget to like, subscribe, and share with your patient access team. Together, we can help everyone understand insurance a little bit better. Thanks for watching or listening, and I'll see you in the next episode. Peace out.